Hello friends, today we are going to discuss about a very important topic, that is hepatitis. So we start with some questionnaires like what is hepatitis and what are the types and causes of hepatitis. So hepatitis refers to inflammation of the liver. Inflammation means swelling of the liver that is caused by any injury or some infection. It is a part of the biological response due to liver damage caused by infection or injury. This inflammation can affect how well the liver functions. So there are different types of hepatitis with different causes. Mainly there are 4 types of hepatitis. One is viral hepatitis, that is caused by the viruses. Second is alcoholic hepatitis, which is caused by heavy alcohol use. Third is toxic hepatitis, that is caused by certain poisons, chemicals, medicine or supplements. And fourth is autoimmune hepatitis, that is a chronic type in which body's own immune system attacks the liver. The exact cause of this is not known, and it is basically because of some genetic and environmental factor. Second is, what is viral hepatitis? What are its types? What are the risk factors and mode of transmission of viral hepatitis, and how common it is in India? Now we will discuss one by one the different types of hepatitis, its mode of transmission, it's how we can prevent this type of hepatitis. So what is viral hepatitis? What are the types and what are the risk factors and mode of transmission? So viral hepatitis refers to hepatitis caused by specific virus that primarily attack the liver. For example, hepatitis A, B, C, E and D. In India, mostly the hepatitis A and E is common, followed by the hepatitis B and C. And D we usually do not see in India. The D hepatitis is always accompanied with hepatitis B. So basically we deal only with hepatitis A, B, C, E. Now hepatitis A virus and hepatitis E virus is transmitted through fecal-oral route via ingestion of contaminated food and water. Whereas hepatitis B and C is transmitted through contact with blood or other body fluids, including sex with an infected partner, injection drug use that involves sharing needles, syringes or drug preparation equipment and needle sticks, or exposure to sharp instruments, and from mother to child during birth and delivery. Now, what is alcoholic hepatitis and what are the risk factors? So, alcoholic hepatitis is inflammatory condition of the liver caused by heavy alcohol consumption over an extended period. The body's process of breaking down alcohol produces highly toxic chemicals. These chemicals trigger inflammation that destroy liver cells. Alcoholic hepatitis occurs in approximately 1/3 of chronic alcohol drinkers. Now, what are the risk factors? Gender. Women seem to have higher risk of developing alcoholic hepatitis as compared to male. Obesity, genetic factors, binge drinking. Binge drinking means having 5 or more drinks within 2 hours for men, and 4 or more drink in women is defined as binge drinking, and this binge drinking is more dangerous. And other factor is malnutrition, like those people who are malnourished, their immune power, their body power is very less, they are not able to digest the alcohol properly, they are more predisposed to alcoholic hepatitis. Now, what are the signs and symptoms of hepatitis? How you can suspect that you are developing hepatitis? So, some patients with hepatitis might not have symptoms and do not know that they are infected. If symptoms develop, they may include fever, flu-like symptoms, fatigue, loss of appetite, nausea or vomiting, abdominal pain, dark urine, clay-colored stool, joint pain, jaundice or yellowing of your skin and eyes. Now question comes, how will you diagnose the hepatitis? So diagnosis of hepatitis can be made from these parameters like history and physical examination, To diagnose hepatitis, doctor will take history of patient to determine any risk factor to identify infections or non-infectious hepatitis. Physical examination is done by the doctor to see whether it is liver is enlarged, patient is having yellow eye or not. Blood test, we generally order blood test like liver function test that helps us in determine whether the patient is having acute hepatitis or chronic hepatitis. There are certain blood tests available to diagnose the viral hepatitis like HBsAg, NTSCV, HAV, HEV virus infection, virus serology. Then we order ultrasound to see what is the condition of the liver, whether it's a hepatitis or whether it is due to some obstruction by stone or some tumor. And in some cases, we require biopsy also, especially in cases of autoimmune hepatitis, where the parameters are not fulfilling. The final diagnosis is usually made by the biopsy, liver biopsy. Now question arises, how we can prevent the viral hepatitis or hepatitis in large. So viral hepatitis can be prevented by taking the proper precautions like drinking safe and hygienic water, stay away from the people who are having this viral hepatitis symptoms, by following safe sexual practices, avoid using syringes or needles or laser. We should not share these things with each other, and by proper vaccination. The vaccines are available for hepatitis A and B, and if the person is vaccinated, he will not develop the viral hepatitis in the future. But for hepatitis E and hepatitis C, we don't have any vaccine as such, but we have a very good treatment for hepatitis C. If you see the treatment of hepatitis, especially the viral hepatitis A and E, usually 99% chance is that it usually recover by its own. 1% patient, they develop complication, and sometime they may land up into the liver transplantation. But overall, 99% patient who are infected with hepatitis A and hepatitis E, they recover spontaneously with just supportive treatment. Whereas for hepatitis B and C, when they become chronic, they require special medicines which are given, by which we can cure the hepatitis C, but for hepatitis B, we have to give the treatment for a long period of time, because till now we don't have any medicine which can cure the virus. But medicines are available that can stop the replication of the virus, that can stop multiplying, that can stop this virus to multiply in the liver. So this is for autoimmune hepatitis. There are treatment available for toxins and other hepatitis. Usually the patient require hospitalizations, and by conservative measures they also improve. So by and large, hepatitis is a common condition of the liver. Around 1.5 to 2.5% patients are having this hepatitis B. Overall, in general population, our entire if you see the entire population, 1.5 to 2.5% patient, they are infected with hepatitis B, and 0.5 to 1.5% people of entire India, they are infected with hepatitis C. So you can estimate that roughly around 1 to 1.5 crore people are still infected with hepatitis C, whereas around 2 to 2.5 crore people, they are having hepatitis B. So which number is very large, and it can be prevented by simple measures. I request all of you that those people who are not vaccinated, they have not taken vaccine for hepatitis B or hepatitis A, they must take vaccine. Simple measures, and that can save a lot of life. And those people who are having symptoms, they develop symptoms of hepatitis, they quickly consult the doctors. There are treatment available and can be cured. Thank you very much.